Hi there. Hello, Mr. Filipov.
Hello.
I have a question of vital importance about alcohol. Are people with diabetes allowed to drink alcohol?
You know, both diabetics and non-diabetics make their choices regarding alcohol consumption for personal reasons. Diabetes is not an absolute contraindication to alcohol. However, some people abstain from alcohol because it is very difficult for them to calculate its effect on their blood glucose level. It is harder for them to maintain the blood glucose level, so they abstain from alcohol altogether.
And those diabetics who do consume alcohol can somehow calculate it?
You know, alcohol directly affects the blood glucose level. This effect is well known. We know that alcohol is toxic, right?
Right.
One of the elements of this toxic effect is that alcohol blocks the release of glucose from liver into the bloodstream. It happens in all people, whether or not they are diabetic.
And the blood glucose level drops.
The blood glucose level in a person with diabetes may drop due to alcohol. However, if one consumes alcohol excessively, the more alcohol gets into the bloodstream, the stronger the liver blockage and for a longer period of time.
Is there an amount we can call a permissible one?
There are insignificant amounts. Alcohol may even be produced in the body during digestion.
I heard about that.
Well, we believe that the amount of alcohol equal to a glass of dry wine does not significantly affect the blood glucose level of an adult. A glass of red wine, the equivalent of this dose, should not produce any significant effect. In other cases, we may divide. Calculations are difficult because very often drinks are not limited to just red wine. In fact, there are a lot of beverages, and all of them produce different effects.
Are there good or bad ones? For instance, wine. I got the idea. What about spirits?
For the convenience of people with diabetes, we don't speak of beverages as being good or bad. We rather speak of beverages that contain alcohol but do not have any significant amount of glucose. These only reduce the glucose level. The more alcohol is consumed with those beverages, the greater and longer the glucose level drop. And there are other beverages that contain both alcohol and a relatively high concentration of glucose, sugar.
Some kind of sweet wine.
There are plenty of them. They include beer, sweet wine, off-dry wine, dessert champagne, vermouth. There are many of them.
But the amount is the key. It should be the one you've mentioned. We are clear on that one. But higher amounts are questionable, right?
The fact is, alcohol unpredictably affects the blood glucose level. The same amount of the same beverage consumed by the same person may produce different effects on different days.
There's a risk.
There are risks, and they are difficult to calculate. It's like asking someone to inject an unknown dose of unknown insulin.
I see.
It's impossible to predict the effect. We may check, but results will vary from day to day.
Thank you very much, Mr. Filipov. Now, the question to drink or not to drink is clear.